Thank you, Erin. I'm very honored to be here recording this presentation today, and I thank you, listeners, for taking the time to listen to this topic. I personally find the topic of walking speed to be fascinating, and I hope you will find it to be interesting as well. So I really have two course objectives for our time together today. I hope to help you understand the broad predictive value of walking speed, as well as be able to describe the rationale and evidence for using walking speed as the sixth vital sign. So when I searched the literature for this talk last month, I found that when I used the search terms for walking speed or gait speed, and those terms are really interchangeable, I found over 10,000 articles. And then when I tried to narrow the search by adding either older adults or elderly to the search terms, there were still almost 8,500 articles. So you can see that the majority of the research on walking speed has been done on populations of older adults. The point is, there's a large body of research on walking speed. The challenge isn't finding the research, it's searching through it and paring it down. So why does walking speed matter? It seems like a good thing to start with. Well, after we take a look at this very limited subset of research on walking speed, we're certainly not going to cover the 10,000 articles. It will still be enough to help you see what an important and poignant measure it is. First of all, walking is very important. And I found some opening sentences from various research papers that are poignant statements and help to set the stage for this topic today. One paper started out by saying the ability to walk is highly valued by human beings. Certainly a simple statement, yet very profound. Another paper started with, walking is second only to private cars as the most common means by which individuals get from place to place in the USA and Europe. So not only is walking important, but walking speed is important too. A common complaint of older adults is that they cannot walk the way they used to. This is certainly something that I have heard many times as a geriatric physical therapist. And what I hope to help you see today is that walking speed is indicative of an individual's functional capacity and also their general health status. So it's walking speed's predictive value that's drawn much of its focus to the forefront of the research. A person's response to rehabilitation in physical therapy, occupational therapy, speech therapy can be predicted just from how fast they're able to walk. Their functional dependence, how much help they need doing their activities of daily living, can also be predicted by how fast they walk. Frailty is another predictor. In fact, walking speed is one of the 5 markers of frailty. Mobility disability can be predicted by how fast someone walks. So what their mobility level is like at home as well as in the community. Cognitive decline can also be predicted. So their cognition, even though it's totally separate from the act of walking, it still can be predicted by one's walking speed. Whether one is going to fall and even how many falls they'll have, and if they will get injured when they fall, can also be predicted by walking speed. Walking speed is also predictive of fractures, whether someone will fracture when they fall. It's predictive of whether they will be institutionalized, whether they will have to live in a skilled nursing facility. It's predictive of whether they'll be hospitalized or not. And then once they are hospitalized, how long they're going to have to stay in the hospital. Then once they're ready to leave the hospital, how fast they walk will also help to predict their discharge location, whether they're able to return home or whether they're going to have to go to a transitional care facility or a nursing home. Walking speed can also predict cardiovascular related events as well as mortality. And then the Holy Grail, walking speed can predict all-cause mortality, whether someone will die from any cause for any reason. And the list continues. Walking speed is also predictive of how active someone is. It's predictive of their strength in their legs. It's also predictive of how one functions overall. And it also helps predict how someone will rate how healthy they think that they are. Again, showing how inherently valued walking speed is by individuals. So this is a list of just 17 items, and it wasn't even exhaustive. But I think this already begins to show you what a powerful measure walking speed is. Another study looked at how walking speed can predict health status and hospital costs. And what the authors found is that for each increment of a decline of 1/10 of a meter per second in walking speed was associated with poorer health status, poorer physical functioning, more disabilities. Certainly all of these are quality of life issues, but it was also predictive of how many additional rehab visits they would need, physical therapy, occupational therapy, etc. It was predictive of increased medical surgical visits, how long they were going to have to stay in the hospital, and that they did need to stay in the hospital longer. And it was also indicative of an increased cost of over $1,300, again for each increment of 0.1 meters per second decline. So we've looked at multiple factors that can be predicted by one's walking speed, but let's look a little more closely at how walking speed can predict how much longer someone will live. Hardy and colleagues looked at usual walking speed in older adults. They took baseline and quarterly measurements for a year, and out of 6 different measures that they collected that related to health and function, walking speed was the only measure that was associated with survival. They found that an improved walking speed of just 1/10 of a meter per second over a 12-month period predicted substantial reduction in mortality. So if we convert that, 1/10 of a meter per second converts to just under 4 inches further per second, which is a very subtle yet detectable change in speed. So looking at their data here, again, as we look at the table, we can see that there's an improvement in usual walking speed, or that an improvement in usual walking speed predicts a substantial reduction in mortality. So if you look at the top row, those subjects were able to improve their walking speed over the period of a year and also maintain that increase. And then their absolute risk of death at the end of 8 years was 31.5%. In the second line, those who were able to improve their gait speed, but they weren't able to improve it for the full, or maintain it for the full year, they had an absolute risk of death of 41% at the end of 8 years. But then those who were never able to increase how fast they were able to walk over a year's period had almost a 50% absolute risk of death. So you can see a substantial difference between the first line and the third line. So those who were able to improve their gait speed by just 1/10 of a meter per second or greater over that year had a 17.7% decrease in their absolute risk of death. This is a seminal study conducted by Studensky and colleagues. Stephanie Studensky is a geriatrician and spent many of her years of her career at Pitt, University of Pittsburgh, and then now has moved on to the National Institute of Aging. And she's done a lot of research on gait speed and walking speed in older adults. And this was a meta-analysis that was published in JAMA in January of 2011. And it was a pooled analysis of 9 cohort studies. So when they pooled those studies together, their subject pool was over 34,000 subjects. And these were community-dwelling older adults. And they took their baseline gait speed and then also followed them anywhere from 6 to 21 years out from the beginning of the study. And it just depended on which study had the longer follow-up. And their main outcome measures, they were looking at survival rates and life expectancy. And what they found is that walking speed was associated with survival in all of the studies that they looked at. They also found a wide range of walking speeds. So the subjects within the studies that they looked at walked either at a very slow pace of 0.4 of a meter per second up to a very reasonable community pace of 1.4 meters per second. So again, a wide range of subjects being looked at in the study, the multiple studies. And what they found is that survival increased across the full range of walking speeds, regardless of whether the subject started in the slower group, in the middle, or in the faster categories. All of them were able to live longer if they were able to increase their walking speed by even a small increment of 1/10 of a meter per second. So again, they found these significant increments in increased survival with just 1/10 of a meter per second. And we saw this in the Hardy study earlier also. And then they also found that a decline of just 1/10 of a meter per second was associated with a 12% greater mortality. And gait speed was associated with differences in the probability of survival or mortality at all ages in both sexes, but it was especially informative after age 75. They found that a usual walking speed of greater than or equal to 1 meter per second consistently demonstrated longer survival than expected by age or sex alone. And we'll see this cut point of greater than or equal to 1 meter per second in numerous studies as we continue. The authors found that just looking at the 3 simple items of age, sex, and gait speed predicted survival just as accurately as the longer list of 8 items that you see on the right side. Okay, so let's look at the data here, and let me orient you to the graphs here. These are the results of the study, again from the pooled analysis of the 9 studies that they looked at. And on the left-hand side, you'll see the data for men, and on the right hand, you'll see the data for women. And then along the x-axis, you can see that that's the representation of age, and the y-axis looks at median survival in years. And then what they did is they superimposed the gait speed along the vertical line that you'll see like at age 65, which is where their data started because they were looking at older adults. And what we see initially, very obviously, is that there's an upward shift in women versus men. So if we look at the top gait speed of 1.6 meters per second, that very top solid green line on the left-hand side of the page, on the male graph, you can see that someone who had a gait speed of 1.6 meters per second had a median survival expected to be, somewhere around 32 years. Whereas if you take that high point on the female graph over on the right side of the page, you'll see that a woman at the same age, walking the same speed, had a median survival rate to be expected somewhere around 41 or 42 years. And then if you look down at that same age of 65 to the slowest walking speed on men, just 0.2 or 0.2 of a meter per second, you can see that their median survival is expected to be roughly around 8 years. And if you take that same age-matched and speed-matched female subject, they're expected to have a median survival of around 13 years or so. And then if we follow the graph out to the right to the 95-year-olds, we still see that upward shift that exists between men and women. Those who are walking faster, that are female, still have a longer life expectancy than men, as well as those who are walking slower. So the predicted years of remaining life for each sex and age increased as walking speed increased, and we can see this along the y-axis. So as the authors interpreted these findings, they found that a walking speed of greater than 1.0 meter per second suggested healthier aging, as it consistently demonstrated survival that was longer than expected by age and sex. And not only did they find longer survival, but the subjects also reported healthier, better quality of life. Whereas a walking speed of less than 0.6 of a meter per second demonstrated an increased likelihood of poor health and function. And a walking speed of 0.8 meters per second was found to be the median life expectancy in both sexes and most ages. So based on their results, the authors then proposed some guidelines on how walking speed could be used clinically to guide patient care. So they thought that physicians might be able to help identify older adults with a high probability of living 5 to 10 or more years to target medical interventions that require years for benefit. Physicians could also identify older adults with increased risk of early mortality and therefore examine them for further modifiable risks for health and survival. Physicians could also monitor walking speed over time because a decline would indicate a new health issue with a need for evaluation. They also thought walking speed would be a good communication vehicle between healthcare providers and the patient, could help stratify risks from surgery or chemotherapy, and they also thought it could assess the effectiveness of medical and behavioral interventions in clinical trials by their effect on walking speed. So using walking speed as the outcome measure in clinical trials. So let's take a look at why walking speed might predict survival. Well, first of all, walking is a very complex motor task. It requires energy, it requires movement control and support, and walking places demands on multiple organ systems like the heart and the lungs, the circulatory system, the nervous system, musculoskeletal system. So then slowing walking speed may reflect damaged systems to any one of the 5 or more listed above, and it may also reflect the high energy cost of walking. So improved walking speed over time may indicate a subclinical indicator of a physiological reserve or a kind of resilience, an ability to improve or recover from a prior stressful event. It may indicate improved physiological health due to medical interventions or a change in health behaviors such as physical exercise. I'd like to share a few summary statements from the authors in the Studenski paper. Gait speed could be considered a simple and accessible summary indicator of vitality because it integrates known and unrecognized disturbances in multiple organ systems, many of which affect survival. In addition, decreasing mobility may induce a vicious cycle of reduced physical activity and deconditioning that has a direct effect on both health and survival. So staying active and maintaining our mobility can have a direct effect on how long we live, as well as our quality of life. Because of the strength of the evidence on walking speed, it's been recommended as a possible vital sign in older adults, which would make it the 6th vital sign. The Hardy and Studenski papers we just reviewed have added to the robust evidence in support of routine clinical measurement of walking speed, especially with its predictive nature, especially related to survival. So I thought it would be helpful to go back and actually look at what a definition of a vital sign is. I certainly know what the vital signs are, but I didn't know if I could really give a definition of what they really are. And what I found is that vital signs are screening measures that reflect the integration of health, disease, fitness, and also emotional state. And walking speed possesses those reflective and predictive values. We know the list of predictive values of walking speed is rather exhaustive, as we've already discussed. The promotion of walking speed to be the 6th vital sign comes from its ability to predict both functional and physiological changes, just like other vital signs. The fact that it has cutoff values that are indicative of specific outcomes is also just like other vital signs. And like blood pressure, walking speed may be a general indicator that can predict future events and reflect underlying physiological processes. Walking speed is both prognostic and it's predictive, and both of those are key components of a vital sign. Walking speed can guide clinical decision making, also important for a vital sign. And using walking speed as a screening measure, it can identify those people who are at risk of adverse events or in need of intervention. Early Studenski research proposed that walking speed be considered the 6th vital sign, and current research continues to support this designation. In fact, Stephanie Studenski, who I mentioned is a geriatrician, actually set up laser lights in her clinic to automatically measure walking speed on all of her patients when they were brought into the clinic. Physical therapists are movement specialists, and we can intervene to improve mobility disabilities and help reverse declining walking speed. Research shows us that walking speed is a useful measurement for screening older adults who may need detailed physical therapy evaluation and intervention. In fact, it's been shown that a decrease in walking speed of just 1/10 of a meter per second or more There are a couple of different walking speeds that we measure clinically and that are studied in the literature, so we'll take a look at those now. The terms that we use for these different walking speeds are either usual walking speed, also known as comfortable walking speed, self-selected walking speed, habitual walking speed. They all mean the same thing. They're just different terms that are used in different papers and research labs. And this is the speed that is most often studied. Usual walking speed has been shown to slow 1 to 2% per decade under age 62, and then the rate of decline increases to 16% per decade once we hit age 63 or above. So again, usual walking speed is the most often studied. However, we also take a look at maximal walking speed or fast walking speed. Again, interchangeable terms there. Usual walking speed has been purported to be the most appropriate functional outcome measure for pharmacological trials in frail older adults. All walking speeds are influenced by a number of different items. First of all, age. We know that walking speed decreases with aging. It's also influenced by sex. Men typically walk faster than women. It's influenced by height because of leg length. So taller individuals usually have a faster walking speed than shorter individuals. It's influenced by lower extremity muscle strength and also by body composition. So someone with an increased BMI or body mass index tends to have a slower walking speed. This was a systematic review done by a group of physical therapist researchers just published last year. And they found that walking speed is the result of the complex interplay of 6 different factors. First, multiple body structures and functions, proactive and reactive postural control. So can we both anticipate as well as react quickly enough to postural perturbations? It's related to lower extremity strength as well as aerobic capacity, and proprioception, which is the awareness of where our joints are at in space, and it's also affected by vision. So again, this is evidence of the complexity of walking. The absolute change in walking speed is not the only variable of interest. An individual's walking speed trajectory has health implications as well. And trajectories with a rapid decline are more strongly associated with mortality than stable trajectories, even though they may be declining. So the rate of change, whether it's slow or rapid, in addition to the amount of change, is very, very important. Rich Bohannon, who is a physical therapist and researcher, published one of the earlier studies establishing normative values in walking speed. And his subjects included a wide age range from 20 to 79. He looked at both comfortable and maximum walking speed and found that they both correlated significantly with age, height, and lower extremity muscle strength. And muscle strength was most strongly correlated with walking speed. Hip abduction, or the motion that brings our leg out to the side, kind of like when we're doing a jumping jack, was associated with comfortable walking speed. And this muscle group is really important for stabilizing our pelvis during walking. And the knee extension, or our quadricep muscles, the muscles that straighten our knee, was found to be correlated with maximum gait speed. And our quadricep muscles help to keep us upright against gravity so that our knees don't collapse when we're standing on them or walking on them. So the take-home message here is the importance of strengthening these muscles. Normative values can be used to determine how an individual's walking speed compares with the average for healthy individuals of the same gender and age. So I use these clinically with my patients so that they understand how they fit in with healthy age-matched normals, so they have a goal for where they want to strive to be. So this is kind of a busy slide looking at the data from the Bohannon study. And you can see on the left, it's looking at comfortable walking speed, and then on the right, the graph is looking at maximum walking speed. And on each of the comfortable and max, you can see that the middle column is identifying the data on men, and the right-hand column is identifying the data on women. And I put a highlight around the decades of 60s and 70s since that's where my interest lies in working with older adults. And you can see that with a comfortable walking speed, men were walking an average of 1.36 meters per second in their 60s, and then a slight decline to 1.33 meters per second in their 70s. Whereas women in comfortable walking speed started out somewhat slower at 1.30 and declined to 1.27 in their 70s. And then if we look at maximum walking speed, we can see that men started out about 1.93, and interestingly enough, the data show that they actually increased their walking speed into their 70s. It's kind of interesting as to why that might happen. Women started at 1.77 for maximum walking speed and declined to 1.75 in their 70s. So this is the same study looking at the data in a graph format. And here the authors combined the data on both men and women, so it's collapsed together. And the solid line along the bottom is indicating usual walking speed. And you can see just a slight increase from the 20s to the 30s, and then just a slight decline as they age in the various decades past that. Then the dotted line on the top of the graph represents max walking speed. And you can see that there's almost a linear decline in max walking speed from the 20s to the 60s. So Rich Bohannon's study only included subjects up to age 79. So Chu and Lasardi recently expanded the age range of subjects to 98, focusing just on older adults, whereas Bohannon's study included younger adults down into the 20s. Chu and Lasardi focused on older adults, and their subjects ranged from age 72 to 98. And the mean age was 84.8 years old. And this is important because the oldest old, which is considered those who are 85 and older, is the fastest growing segment of society. So having data on this age range is very important. They looked at both self-selected walking speed as well as fast walking speed and found significant differences. They found a consistent age effect with men walking faster than women. We talked about that before. But even after the data was normalized for leg length, men still walked faster at both speeds. So there's a significant gender effect also. Then in the same study, when analyzing walking speed further, the authors found a significant age effect for the cadence of walking, which is how fast we walk or our speed, and it decreases with age. Our step length decreases, and the stride length also decreases. So just to clarify, step length is how far we step with just one leg, either the right or the left, whereas stride length is how far we step with both legs together, so the combination of a step with the right and the left. And then they also found the percentage of gait cycles spent in stance time, or when one of our legs is in contact with the ground, increased, and the time that our leg was swinging through to take the next step actually decreases with age. And we found a decline in single limb support time. So the time that just one leg is on the ground decreased, but the time in which two legs were on the ground actually increased. And these changes continued in these directions as people continued to age. So let's look at their results. So again, just to orient you to the graph, you'll see the top third of the graph is looking at the data on women, the middle third on men, and then the bottom third, they combined the data on both men and women. Then in the second column, you can see the decade that they were looking at. And then the third column is the N, or the number of subjects that fell into each of those decades. And as we take a look at that, you can see that obviously there were far more female subjects than male subjects, which is typical of any research in older adults since women live longer than men. This is the first study that actually included data on men in their 90s, but you can see that the N was very small. There were only 5 subjects. So we have to use some caution when interpreting the data, but yet this is still very valuable because, again, this is the first time that data has ever been reported. And then as we go to the fourth or right column, we can see the mean walking speed. These values are slightly faster than the Bohannon study, but again, still within similar ranges. So that previous slide looked at the data on self-selected walking speed. This slide looks at the data on fast walking speed. Here, these values are slightly less than the Bohannon study. So here's another study, and this was a meta-analysis that pooled 41 studies together, and they were looking at normal walking speed or self-selected walking speed, also conducted by Bohannon and another colleague, Andrews. And the purpose of a meta-analysis was to use data from multiple relevant but diverse studies to estimate norms for normal walking speed that could be used in clinical practice. So again, you can see that the N in the second column dramatically increases with age because more research is done on walking speed in older adults versus young adults. So the data here is really nice because you can see how large the subject pools are. So it's potentially more reliable to look at this data because of the high number of subjects. The one downside of this study is that they did combine the decades of the 80s and 90s together versus separating them out. So it's not quite as useful clinically when we have to group people in a 20-year age range instead of just a 10-year age range. So we've looked at the data on what the normative values are for walking speed. Now, how do we interpret it? We're just going to focus on self-selected walking speed or usual walking speed. We're not going to really look too much at max walking speed. Studensky's work established these cut points, and they've been supported in other research as well. Middleton and colleagues added the use of colored flags, and they utilized a familiar stoplight analogy to make the interpretation more usable and understandable. They considered green flag walking speeds to be those individuals who walk greater than 1 meter per second, and these would be termed fast walkers. And they considered yellow flag walking speeds to be those who walk between 0.6 and 1.0 meters per second, and these would be identified as intermediate walkers. And then the red flag or slow walkers are those who walk less than or equal to 0.6 meters per second. As physical therapists, this is an example of how we can document our patients' walking speed for insurance or Medicare, but also to communicate with physicians, nurses, other healthcare providers, as well as explaining walking speed to patients and their families. So for example, if someone is walking greater than 1.0 meters per second, we could insert their walking speed into where that parenthesis is on the first line of the bullet and indicate that this patient's walking speed reaches or exceeds the minimal necessary speed for community ambulation, suggesting that he or she is capable of walking in the community, less likely to be hospitalized, more independent in self-cares, and less likely to have other adverse events. And here, those who are walking in the intermediate walker category or the yellow flag walking speeds, their walking speed would indicate that they may have difficulty or limited ability to ambulate in the community, like to a doctor's appointment, etc., and that he or she may be at increased risk of falls. So you can see how they were pulling from the research on the predictive value of walking speed to make it meaningful to patients, other healthcare providers, or even payers. And then lastly, looking at the slow walkers, those who are walking less than 0.6 meters per second, their walking speed is severely impaired. It's likely that they are capable only of walking, of only limited community or just household ambulation. It indicates her or his dependence in activities of daily living, and it puts him or her at risk for hospitalization. All right, so we've seen that walking speed decreases with age. So these researchers looked specifically at the age-related slowing of walking speed, and they found that the energy expenditure during walking is progressively higher after age 65, and especially heightened after age 80. And this relationship remained significant after adjusting for multiple impairments and comorbidities. And they found that slower walking may reflect a compensatory action to offset increased energetic costs of walking associated with aging. So it might not be that they can't walk faster, but that it just takes too much energy to walk faster. And they found that slowing walking speed frequently precedes mobility limitations and disability. Again, indicating that slowing walking speed would indicate a need for a referral to physical therapy. Now, this is a busy slide, but it has a lot of rich data on it. This is a table of the results from the Middleton review, and it's a pictorial representation of the study results in their systematic review. So let me orient you to the slide. If you look at the right-hand side of the table, you can see that most of the gait speeds are color-coded green because these are studies that identified individuals who are walking in that green flag gait speed of greater than 1.0 meters per second, and it indicates the abilities that the tasks that they're able to do. If we go to the far left of the table, these are individuals who are walking very slow, like 0.4 meters per second or less, or 0.6 or less, and you can see how their impairments are significant related to their walking speed. And in the middle of the table is the yellow or intermediate walkers. So if we start at the top right, you can see that those individuals from that study were less likely to be hospitalized or have adverse events, and they were independent in their activities of daily living. All the way, if we follow that top line to the left, that was another study that found those who were walking less than 0.2 meters per second were extremely frail. Moving down from that, a study that found individuals walking 0.6 or 0.7 meters per second or less, they've had a higher risk of death, hospitalization, and falls. And following that second line to the right into the yellow flag category, those who are walking in that intermediate gait speed were predicted to have a cognitive decline in 5 years. And following it to the right, those who were walking at 1.0 meter per second or faster were able to carry groceries and do light yard work. Again, going right underneath that, those walking 1.3 meters per second or faster were found to be extremely fit and climb many stairs, whereas to the left on that third line, those walking at 0.4 meter per second or less demonstrated functional impairments and had severe walking disability. Then if we follow down to the next line from the second line from the bottom, those on the left that were walking less than 0.2 meters per second were found to be highly dependent, and when they left the hospital they had to discharge to a skilled nursing facility. And if we move to the right where we get into some of the yellow gait speeds, 90% of those were able to discharge home from the hospital. And further on to the right, with faster gait speeds yet, they demonstrated an increased independence and self-care. And then on the bottom line, starting at the very left, again in the red flag gait speeds, those were limited to household ambulation, and those in the middle of the graph, they were able to demonstrate limited community ambulation, and as it speeded up, as their gait speed increased, they were able to demonstrate some community ambulation, and those that were able to walk 1.3 meter per second or faster were able to cross the street safely. Well, we've talked a lot about walking speed thus far, so now let's talk about briefly how we might measure it. So many different distances have been validated for measuring walking speed, but the most common distance is a 20-meter walkway with 5 meters allowed for acceleration, and then timing the middle 10-meter section, and then 5 meters allowed for deceleration. And the verbal cue that we give our patients is for usual walking speed, we would simply ask them to walk at a comfortable pace. Whereas if we're testing maximal walking speed, we would ask them to walk as fast as possible and safely without running. Then once we have that time, we would just divide the distance, which is 10 meters, by the time in seconds. And of course, there is an app for that will self-calculate gait speed. But you can see that gait speed is quick and easy to test, which makes it relevant to select as a vital sign. As a physical therapist who specialized in working with older adults, I've seen time and again the detrimental effects that the cycle of fear can have on individuals. So looking at this graph here, if we look at the very left and the box on the left that says fall or near fall, here's where a patient typically starts the cycle. Either they experience a fall or a near fall themselves, or they have a close friend or family member who has fallen and they see the detrimental effects that that person has experienced related to that. So then because of that fear, we follow the arrows clockwise, and we see that because of that fear, they start to decrease their activity. Because their thoughts are, if they're less active, they're not going to have as much risk of falling. Then as they decrease that activity, we continue to move clockwise, then their muscles start to get weaker. And as their muscles get weaker, their walking gets more unsteady. As their walking gets more unsteady, their confidence really decreases. And as their confidence decreases, they become more inactive because they're more fearful of falling. And then as they become more inactive, they have a higher risk of falling. So you can see that this is a downward spiral. And the nice thing is that physical therapy can intervene at any point in this whole cycle. Because sarcopenia, which is an age-related loss of muscle mass, and muscle weakness are so prevalent in the aging population, it's important for us as physical therapists to devise strategies for preserving or increasing muscle mass in older adults. Research shows us that with increasing muscle strength come increased levels of spontaneous activity in both healthy, independent older adults, as well as those who are frail or very old. So now looking at this slide, starting in the left corner where it started as activity, by physical therapists helping our patients to be more active, as we follow this cycle clockwise, we can see that there's some natural strengthening that will occur. And as they get stronger, they get more confident. And as they become more confident, they start to increase their mobility. And as they increase their mobility, their balance improves. Then as their balance improves, they increase their activity level, and this whole cycle continues, but it's an upward spiral. So activity is important, and also is strength training. Strength training is very important for older adults to increase their activity levels. So in summary, walking speed is a well-researched measure, as I hope you've been able to tell. It's also highly valued by individuals to improve their quality of life. It has strong predictive value, including survival, which tends to be a rather penultimate outcome measure. It's easy to calculate, actually takes less than a minute. It's indicative of an individual's functional capacity and also their general health status. Again, strong quality of life measures. All of which leads to it being advocated as the sixth vital sign. And walking speed can be improved with physical therapy intervention. Thank you for your attention and your interest, and I'm grateful for the opportunity to have shared this presentation with you today.
Wonderful. Thank you so much, Becky. What a great presentation. All right, so we are going to wrap this up. Thank you so much again. And if you'd like to learn more about ways to stay connected with the University of Minnesota and its 455,000 plus alumni worldwide, please be sure to visit us at minnesotaalumni.org.